Welcome. We're just taking a few moments while we get live on Facebook, and then we'll begin the briefing. Welcome to this press briefing with Public Health Seattle and King County. My name is Kate Cole, and we'll be hearing from our health officer, Dr. Jeff Duchin. Dr. Duchin, I'll turn it to you.
Thanks, Kate, and good afternoon, everyone. Thanks for joining us today. Since our outbreak was recognized in February of 2020, we've had approximately 80,000 COVID-19 cases with over 5,000 hospitalizations and 1,331 deaths reported in King County. Over the last 7 days, we've seen approximately 128 new cases reported daily. Approximately a third of those are in adults 18 to 35 years of age. And the trend of cases has been decreasing in the past month, which is very gratifying. And it represents a transition from CDC's high risk to their substantial risk category. And substantial really means substantial. Not all cases that are reported not all cases that are diagnosed or occur are reported. That's probably more like several thousand occurring each week than the ones we hear about. And it's still a tremendous relief to see these numbers continue to fall over the past several weeks. We are 80% of the way back to where we were in September before the fall and winter surge. The daily counts of hospitalizations and deaths have also been decreasing, but they lag behind the cases. So we're still seeing about 13 patients hospitalized each day over the past week, and about 3 people dying from COVID-19 every day last week. But that's down from 8 to 9 dying per day during late December. So I want to take a minute and thank everyone who's been taking precautions to help make this happen. Nonetheless, we continue to see disparities with the impact of COVID-19, including in our cases, hospitalizations, and deaths, which remain highest in cities in South King County and among people of color, including Black, Hispanic, Native Hawaiian, Pacific Islanders in our county. Now, our falling COVID numbers show that we can change the course of this epidemic when we limit our activities, when we wear well-made and well-fit face masks, and we take other COVID-19 precautions. But it's critical not to become overconfident and complacent, because although we've slowed it, there's plenty of virus out there and plenty of opportunities for it to spread still. Although total COVID-19 cases are decreasing currently, the proportion of cases due to the more contagious B.1.1.7 variant continues to grow, and that proportion doubles approximately every 10 days. And that means by sometime in March, most of the SARS-CoV-2 viruses circulating will be the variant strain. And although it's impossible to predict the extent to which new variants may change the trajectory of our outbreak going forward, it would be reckless not to be more careful and more effective in our prevention measures against a stronger virus in order to decrease the risk for a large fourth wave of COVID-19 cases. These variant strains spread from person to person the same way as other strains do, primarily through the air, but they're better at it. And that means if you're exposed to someone with COVID-19, you'll be more likely to catch it, and people with COVID-19 will be more likely to spread it to others more quickly. And it's important to remember that this virus spreads primarily through the air, that it can accumulate in closed spaces where there's not good ventilation, just like cigarette smoke or perfume will, and that we can reduce our risk by spending less time in such places, in closed indoor environments, always wearing masks and good quality and well-fitting masks, and maintaining as much distance as possible indoors, and taking other steps to improve ventilation and air circulation indoors. And of course, as always, doing as much as possible outdoors. Well, the good news for us, I think, is if we can continue to drive down the level of COVID-19 in our community now, we will have fewer total cases of COVID-19 and fewer opportunities for COVID-19 to spread when the variant does become the more widespread strain. So going forward, we'll need to fight two enemies, the virus and complacency. Enhanced COVID-19 precautions, along with increasing vaccination coverage over time, should help limit the impact of a fourth wave. And as always, testing, isolation, and quarantine remain key to early identification of COVID-19 and limiting further spread. And we know that due to the weather and snow, which disrupted much of our local activities and more in other parts of the country, we saw a decrease in the number of people getting tested. And now that the weather's cleared and people can safely access testing, we encourage those who've been exposed to someone with COVID-19 or anyone who has symptoms to remember to be tested right away, to isolate themselves from others, and if you're diagnosed, to let others know who you've been in contact with so they can quarantine and be tested themselves. I think if we all hang in there for a few more months and finish strong, there's a good chance we will be through the worst of this outbreak as more of us get vaccinated in the coming months. And with that, I'd like to say a few words about vaccine. And of course, you are all aware that severe winter storms across the nation have led to delays in vaccine shipments. And this has impacted the vaccinations that are taking place here in Washington State and in King County, both those scheduled this week and into the weekend. And we we at Public Health and other providers are reaching out to reschedule appointments. And anyone with a canceled second dose appointment should make sure to reschedule with the same provider as their original appointment. For the community vaccination sites that we operate in Kent and Auburn, appointments scheduled for today after 4 p.m. are being rescheduled due to the lack of vaccine shipments. And we'll continue to update information on our COVID-19 vaccination page at www.kingcounty.gov/vaccine. So you'll get the latest information about the impacts for the Kent and Auburn sites and other information at that site. Overall, though, despite the delay and despite the relatively limited supply, encouraged by the progress we've been making, over 400,000 doses have been administered to King County residents, including about 65,000 in the last week. On average, we're administering over 9,000 doses per day, and approximately 300,000 people, about 1 in 6, or 16% of King County residents, have received at least one dose. And we've got 119,000 people, or 1 in 16 King County residents, who are fully vaccinated at this point. So we're making progress, and we're making progress also in vaccinating older adults who are our most vulnerable to complications and death from COVID-19. 52% of those 75 and older have received at least one dose, and that's up from 44% last week. And 46% of residents between 65 and 74 years of age have received at least one dose, and that's up from 40% last week. So I'm very encouraged to see more and more people who are at high risk and who are eligible getting vaccinated, but we continue to see disturbing inequities in vaccine access, and I'll share with you some information about this. Our white residents are overrepresented among those with one dose compared to most communities of color. For example, by race and ethnicity. Among people who are 65 years of age and older who identify as white, 45% have been vaccinated. Among American Indians and Alaskan Natives, 50% have been vaccinated. And among Native Hawaiian Pacific Islanders, 47% have been vaccinated. In contrast, among the same age group, 65 and older, who identify as Asian, 37% have been vaccinated. Among those who identify as Hispanic, 31% have been vaccinated. And among those who identify as Black, 25% have been vaccinated. Similarly, if we look at geography, the disparity between vaccination rates in South King County compared to North and Central King County continue to improve, but they continue to exist. And our sites in Kent and Auburn are helping narrow the gap. However, among those 65 and older, the coverage rate on Vashon Island is 62%, and it's 54% in East King County and 53% in North Seattle and Shoreline. That compares to 40% or so in South King County cities of Auburn, Kent, Federal Way, Peoria and Renton, SeaTac, West Seattle, South Seattle, Del Ridge, and Highline. And you can see more of this data and details on our COVID-19 vaccine dashboard. And before I take questions, I'll just share a few updates on how we're working with community to reach some of the most vulnerable eligible adults in our communities that have been hardest hit by the pandemic, including those with transportation and other challenges accessing vaccine. We've been very concerned about homebound adults who are at high risk of not receiving the vaccine, and we've had amazing help from the area agency on aging and teams from our fire departments and volunteers from the University of Washington who are making home visits to provide vaccine. We now have a total of 17 mobile teams in the field vaccinating high-risk populations across the county, reaching residents in adult family homes and affordable housing buildings with large senior populations. And we have community health workers and case managers who are connecting with home healthcare workers and getting them vaccine appointments at our King County Vaccine Partnership site in Redmond, in Renton, and at our Kent and Auburn sites. The City of Seattle is doing tremendous work with partners to set up vaccination events for eligible Latinx older adults, and community-based organizations and community navigators representing 22 languages and ethnic groups continue to be instrumental partners with us, helping those who have language or other barriers sign up for appointments. So there's lots going on. There's lots more to do. We need to close the gaps in those disparities that I've shared with you, both by geography and by race and ethnicity. But I'm encouraged by the collaboration we're getting and the engagement with our community partners in making that happen. So with that, pause and happy to welcome your questions.
Thank you. And as a reminder for media, if you have questions, please use the raise your hand function in Zoom. And when we call on you, please state your name and your media outlet. First up is Jessamine McIntyre.
Hi, Dr. Duchin. Thank you again for your time. Jessamine McIntyre, Q13 Fox. Given the shipping delays that you mentioned and the likelihood or possibility that 2 weeks worth of vaccine could be available in a very small window, what is the plan for distribution in the county as the supply has kind of been the problem all along? Is there capacity to deliver almost twice as many shots in such a small period of time?
Thanks for your question, Jessamine. Yes. Well, it's kind of a good news, bad news question, because the fact that the vaccine allocations have not been extremely large, doubling them is a manageable number for us. So we believe we will be able to allocate a vaccine. Don't forget, we've had many vaccinators who have not yet been able to get vaccine. So we have, I think, good distribution channels, and we're working to prioritize, as always, access for those communities that have been hardest hit with the highest case, hospitalization, and death rates. Among those eligible people who are at highest risk right now are older adults, and trying to get the remaining healthcare providers and caregivers who have not been vaccinated. So we feel pretty confident that, when we get this week's remaining doses and next week's doses, our community partners and our teams are ready to administer them. And again, many of these doses for this week and next week are second doses. So these are people who have been vaccinated in the early weeks of the vaccination campaign and now are due for their second dose. So we're thinking that we'll have a substantial increase in vaccine available for administration of first doses starting, after this 2-week period of catch-up from the second dose gap that's currently existing.
Thank you. Next question is from Elise O'Neill.
Hi, it's Elise O'Neill with KUOW. Thanks for taking our questions. I have 2 questions. The first is, do King County providers have enough low dead space syringes. Is that an issue at all? And the second is about the cases dropping at the moment. And you mentioned that that's due to social distancing. And I was wondering if you think there's any possibility that we're starting to see an effect from vaccination, or if it's behavioral only, the drop in cases.
Yeah, thanks, Aisha, for your questions. I have not heard anything about shortage of or need for additional dead space syringes. We can double check and get back with you if there's something I haven't heard, but that's not an issue to my knowledge. The issue of why are we seeing this drop in cases is a really interesting question. This is something that's being seen across the country, and the rate of drop is quite remarkable. We had a first outbreak in last late winter, early spring, that was largely driven by our long-term care facilities and then spread into the community. Then we had the stay-at-home order, and that interrupted transmission quite effectively, and we went back to a relatively low level of cases. Following that, we had summertime activity and more people getting in contact with one another, and we saw a surge again over the summer, particularly after the holidays, Memorial Day and 4th of July, and then came down again. But not as low as we had come to after the first surge. And then we saw this large wintertime wave, which had been predicted because of both the gatherings that we knew would take place and increase contact in the community, close contact in indoor air spaces, both because of holidays and because of the wintertime driving people indoors. And we know this virus spreads more effectively indoors. It's airborne, it can accumulate. And when people don't take precautions, wear masks, decrease the amount of time they spend together, have too many contacts with people who live outside the home, that all leads to more cases. And then after the holidays, we've seen this dramatic decline, which undoubtedly is in part related to the restrictions that we had imposed in Washington State on activities that kept us apart from one another, which is, a really good indicator that these mitigation measures work. But there's probably also other factors, just related to the fact that people, gather a lot over the holidays, and that drives transmission, and the holidays are over and people are not having as many social gatherings. But other things like, the potential for the virus to be exhausting certain social networks. So, the reproductive number, or the number of people that become infected for every case varies a bit depending on, the type of social behavior in that population. So people who don't have much contact with others, who take precautions, they're less likely to transmit the virus to others in the first place. And people who have a lot of social contacts and may not take precautions, they're more likely to transmit the virus to others and drive up the number of cases and drive up that reproductive rate. Well, those people who are less likely to take precautions and may be more likely to gather have probably been disproportionately impacted by this epidemic to date. And I think perhaps the virus is running into more dead ends because people have developed previous infections and they've got some immunity. And of course, we don't know how long that immunity or that protection will last, but I think that might be part of the reason we're seeing cases drop now. And if this virus was introduced into populations that might be taking more precautions, or that have not been having as many interactions, who now start to have more contact with one another, or for any reason would not be using the recommended precautions to prevent infections, such as masking, there will be more opportunities for spread. And then there's all this issue, this mysterious issue of seasonality that people refer to. It's not clear, what even the best scientists mean by this. I mean, there are some intangible factors that people attribute to emerging viruses and when they cause pandemics, and to seasonal respiratory viruses as well, that that postulate that there's something about environmental conditions, be it humidity or temperature or people's behavior at certain times of year, that affects how these viruses move from person to person. I have a little bit of a hard time attributing much of what we're seeing to the so-called seasonality effect at the moment, because we've got so many still susceptible people in our community that the season really hasn't changed dramatically. I mean, we're still in the winter season. And so I'm attributing the drop more to people's behavior in response to the restrictions that our governor has put in place that limit our ability to contact with one another, and the precautions that people take, and the number of previous infections that is providing some sort of temporary or possibly longer lasting immunity in some social networks. And I feel like there is, a lot of virus still out there, obviously. We have reported a couple of hundred cases a week, but there's a couple of thousand that are actually occurring. And we have more dangerous viruses that are going to be more prevalent pretty soon. And there will be many opportunities if we give the virus opportunities to spread. It will take advantage of those, and as we do more activities, we'll be providing more opportunities unless we do them very carefully. So I don't know. I mean, feel free to ask me now if I didn't answer your question, if I didn't get to all the issues that you were wondering about in that question, but it was kind of a complicated question.
Great. We're going to now take a question from a viewer on Facebook who's wondering if you have an estimate of when we'll move to the next level in the vaccination tiers.
I do not. The vaccination tiers are governed by the state, and we know we've got about half of our highest risk adults who are 65 and older vaccinated in King County, and we've got about 2/3 of our licensed healthcare providers. So there are many people still in the current eligibility groups, many thousands who have not, actually hundreds of thousands perhaps, who have not been vaccinated. And there are also great disparities that we would like to see addressed before we moved on to new eligibility groups among people of color and among certain communities in the county. So we're hoping that we'll be able to close those gaps before we move on to the next phase, but that is something that we don't decide at the local level.
Thanks. Next question from Steve McCarran.
Hi, thanks for taking my question. I wanted to follow up with the first question that was asked about this potential influx of vaccines from the current delayed shipments and then what we're expecting next week for the regular shipments. What is the state telling you guys, telling the county about how to prepare for this influx? And then is the county telling providers about how to prepare for such a substantial amount of doses next week? And do you have any idea how many doses the county is anticipating to get over the next several days?
Mm-hmm. I don't have the numbers handy, but I'm sure we can get them for you. Again, we're not talking about a huge amount of doses to start with. So I think our experience has been from working with our providers that they've got the capacity to administer many more vaccines than they've been able to given the limited supply. So, we're not worried that there's not capacity to deliver the vaccines once, we get them. We've been clamoring for more vaccines because we know we have more delivery capacity than we have supply. So I think our community has clearly demonstrated that they've got, that they're prepared to accept and administer much more vaccine than is currently available. So this delay on top of next week's allocation, which wasn't supposed to increase much anyway, is not going to overwhelm our administration and vaccination delivery capacity.
Next question is from A.T. Boyle.
Sorry, can you hear me now?
Yes.
Good. I wanted to ask about, I received my second dose just this week, and that's great. And and we have neighbors who are doing all sorts of things. It's like looking for concert tickets, clicking to see when, you know, the vaccine is going to be available and not really finding it. What would you advise to people who are a little bit frustrated perhaps by the process of trolling all these potential resources and checking with pharmacies and having a hard time with it?
Yeah, first of all, I'm sorry. I wish we had more vaccine and had vaccine for everyone who wants it right now. But we anticipated from the time we heard about Operation Warp Speed that we would have gradually increasing available vaccine supplies over many months over the winter and spring. And it's a very difficult thing for us to, you know, to have to wait our turn. We're trying to put in place better systems to help people access where vaccine or understand where vaccine is available and access vaccine in their communities. The most current, the Washington State Phase Finder has some information, but it sounds like your neighbors are pretty much aware of the current tools. There's also an 800 phone number that I can pull up for you. I don't have it in front of me, but where Kate can put it in the chat box where you can see it, that people can call to get additional information, or particularly if they have difficulty, if they're not facile with using the internet and need help. And we've been working closely with our community partners in King County to try and provide assistance to adults who don't have the skills or the language, the appropriate language background to, or the appropriate access, technology or internet connectivity to use the internet-based appointment schedulers that are currently available. But what I would tell your community members is, I hope that in the next couple of weeks, we're expecting to have increasing vaccine supplies, and that should make things easier. We're also improving our appointment process. Hopefully we'll have something available within the next couple of weeks when the vaccine supplies start to increase. Over the next 2 weeks, there'll be very few limited, opportunities for first doses. Most of the vaccine coming in will be for administering second doses. And if the timing works out, by the time we get a good, robust supply again for first doses, we'll have some improvements in our ability to find out where you can get vaccine near you.
Thank you. And we've put those phone numbers into the Zoom chat for media, and we're adding it to Facebook now for viewers at home. Next up is Kyla Lafferty.
Hi, Kayla Lafferty, King 5 News. So you mentioned before a lot of these appointments happening right now, or second dose appointments. We've had a lot of people reach out to us. They're concerned about having their appointments rescheduled because of the shipping delays in vaccine, and rescheduling would push them beyond that, timeline for receiving their second dose. What do you want people to understand about this? Maybe not getting the second dose right on that, 28 or 21 day mark, and if that will affect their process at all.
Mm-hmm. Yeah, people shouldn't worry about that at all. The 21 and 28 day mark for the two vaccines, Pfizer and Moderna, are what were studied in the clinical trials. But from everything we know about vaccine administration, delaying a second dose by a couple of weeks or even longer is not going to interfere with the effectiveness of that vaccine. As a matter of fact, there's some studies that suggest an even better response with a slightly longer delay. That said, I wouldn't recommend people delay their doses if they have the opportunity to get it at the recommended interval. But recognizing this, the CDC has clearly stated that up to 6 weeks after the first dose is perfectly acceptable. And, people should not have any worries about the effectiveness of the vaccine when it's administered at those intervals. However, you do have to understand that, when you get your first dose, you're not protected immediately. It takes a couple of weeks to start building protection. And although at about 4 to 6 weeks after your first dose, or even if you're going on schedule 3 to 4 weeks after your first dose, you have substantial protection. The full protection that the vaccine offers really doesn't come until after the second dose. So it's important for everyone, both after their first dose and after their second dose, to remember to continue to take precautions. None of these vaccines will be 100% protective, although they're incredibly effective against preventing severe disease, hospitalization, and death. So someone still may become infected after they've received the first dose, and it's possible someone can become infected after they've received the second dose. And even though they may not get very ill, they may still have a mild infection that they can spread to others. So taking precautions is the most important thing to know about a delayed dose, but not to worry about any impact on the effectiveness of the vaccine series.
Thanks. Next question is another one from people watching on Facebook. Curious if you have info or concerns about a new variant discovered in Finland.
I have not heard about the Finland variant yet, so I would
Okay,
say
great.
I'm happily not concerned about that one. But I will say that the virus mutates constantly, and so every time it mutates, you may say that's a variant, and strictly speaking, it's true. But whether that variant is of any significance or not is another issue. Meaning, does it change the way the virus behaves? Does it change how well it spreads from person to person, or the modes in which it can spread, or the severity of illness that it causes? And when we find a variant that has those characteristics, it's called a variant of concern. And it's, I think, a very sure bet that these variants of concern will be found around the world, including within the US, on a regular basis. The extent to which they become successful in spreading is another issue, and the threat they pose to our vaccines and whether or not vaccines will need to be modified to address these variants is also a separate point. But so I'm not aware of the Finland variant, but I'm not surprised to hear that one's been identified in Finland, and I look forward to reading more about it. Maybe if you're interested. And it turns out to be a noteworthy finding, we can talk about it next Friday.
Great, thank you. Next question from Sue Romero. Sue Romero, if you're speaking, you're still muted.
Hi, can you hear me? Okay. Okay.
Go ahead.
Yesterday, the state epidemiologist, Dr. Lindquist, gave his update for kind of where we are as a state during the pandemic, and he sounded more encouraging, if you will, and actually called the point at which we're at in the pandemic as seeing the light at the end of the tunnel, and just wanted to know if you agreed with that, and does that kind of jive with what you were seeing in the county?
Thanks, Sue. Are you saying he was more encouraging than I am?
Well, you sound a little more cautious in your update.
Yes. Okay. So I think that we are in a good place compared to where we were a month ago, a very good place. And I think our trajectory is excellent, but we're going down, right? That's key. I have a lot of respect for this virus, and I have even more respect for the new variant with respect to the threat that it poses. And I know that we have the tools in our toolbox to suppress transmission and to keep the spread at a low level if we choose to adhere to them. I also know that it's going to be more difficult to maintain the same level of control as the new variant becomes more prevalent. And so, and I also know we're dealing with, a new emerging pathogen that we don't fully understand. So I am very encouraged by where we are compared to where we were. We still have a long way to go to get down to a truly low level of transmission in our community, but we can do it, I know, if we put our minds to it. But I'm very concerned about the potential to see a rebound outbreak when the more contagious virus becomes more prevalent, and particularly if people decide to relax their COVID-19 prevention behaviors. So I think the key is, again, keeping all of our prevention steps front and center, not becoming complacent. As I said, we have two enemies now, the virus and complacency. We shouldn't be falsely reassured that the epidemic is over, that the pandemic is over. It's not close to over. Now, light at the end of the tunnel, absolutely. I mean, vaccines are the light at the end of the tunnel, but as I said before, the tunnel is a little bit longer today with the variant viruses. But the more people we get vaccinated, the fewer that will suffer from severe illness and hospitalization. So that's really outstanding. But again, we must continue to take all these prevention measures, or the virus will come back. It's not forgiving. It's a relentless, and if we give it opportunities to spread, it will. So what that means is decreasing to the extent possible our close contacts and activities outside the home with others, wearing masks, good quality masks. And again, we have lots of good information now on our public health website, Public Health Insider. CDC's produced great information. I've tweeted out some really good resources for people on how to improve their masks, the fit and the filtration of those masks. And then also we've got information about how to contain the spread of COVID-19, limit your risk in your household, also on the Public Health Insider blog. So I'm encouraged. Perhaps I am more cautious than Dr. Lindquist about the need for us to be incredibly careful and vigilant and cautious as we move forward, because the virus is still present. It's better at moving from person to person. And if we become complacent, we will regret it.
We're going to take one final question from Carolyn Bick.
Hi, thank you so much for taking my kind of last minute question. I just want to clarify based on something you said a couple of questions back. You mentioned that that folks shouldn't be worried about getting their doses as late as 6 weeks out for, I believe it's the Pfizer vaccine. But what happens if they go beyond, say, 6 or even 7 weeks between first and second dose, if they truly can't get their hands on the second dose of the vaccine?
Yeah, it's a good question. There's no magical cutoff here. I mean, basically, these guidelines are made based on what's known about administering booster doses for other vaccines. And there's no reason to think that there's a sudden, drop off or a cliff after 6 or 7 weeks. But the point is, we want people to get the vaccine as close as possible to the recommended schedule. Now, if we study different schedules, we may find out that a longer interval, in fact, is better. But at this point, we don't know that. And I'm not encouraging people to stretch out their intervals. But I would not worry personally. If it was me, I would not worry about going over that 6 or 7 week mark and getting the vaccine, several weeks beyond that even. I just would hope that people can get vaccines closer to the recommended intervals. And we don't want our healthcare providers to be scheduling when they have any option to scheduling vaccines for farther than 6 weeks out. But if someone missed that 6 or 7 week period, they absolutely should get vaccinated whenever they can. And personally, I would not worry about a decrease in vaccine effectiveness due to that type of delay.
That's it for questions. Dr. Duchin, any final remarks?
Thank you, everyone, again for joining. I appreciate it, especially as the numbers are going down. I'm glad you're still